what are the innovative parts of this innovative technique? The number one, we have replaced the trocar and protective sleeve of a special instrument set with the trocar and protective sleeve of PFN2 set, which is present in our OT. And number two, we have eliminated the jig portion of the special instrument set and did both proximal as well as distal locking by freehand technique. And number three, we have added a color-coded tibial nail extractor or more improved version of the color-coded tibial nail extractor for RCT nail introducer compositioner to introduce the nail inside the intramedullary canal in proper position. So these three changes makes this innovative technique as a very, very cost-effective way of doing suprapatellar nailing of tibia. So friends, this is not a Jogaru technique. This has very strong mathematical or scientific basis. After jumping so many steps of mathematical equation, we had come to know that the success of interlocking nailing is equal to K into C into P into Z. Whereas K is the expertise in the art of the freehand technique of locking, whereas the C, P and Z are the respectively the availability of the C arm in your OT and protective sleeve in your special instrument set and jig in your special instrument set. If you increase the value of K to such an extent that the Z becomes zero, that is dependence on the jig becomes zero, this creates a scenario where the surgeon has mastered the freehand technique of locking and can perform both proximal as well as distal locking without the jig. So this is the mathematical basis. So we conducted a study between March 20 to March 2025 on 100 cases of non-articular fracture of the tibia done by Dr.Thakur innovative technique of suprapatellar nailing of tibia. So along with the other instruments, we had two pilot instruments. Number one, a color-coded tibial nail extractor, which is present in infrapatellar nailing set, and a more improved version of the color-coded tibial nail extractor called RCT nail introducer compositioner to introduce the nail. This is the skin incision. You can see the transverse incision has been given, but you can give vertical incision also. And this is the innovative part of this innovative. Second picture shows the innovative part of this innovative technique, the introduction of the trocar and protective sleeve from PFN2 set inside the retropatellar space. And the third picture shows the innovative part of this innovative technique, that is the proximal locking by freehand technique. So after making a hole just medial to the lateral tibial spine, we introduce a malleable guide wire. After percutaneous reduction of the fracture with the percutaneous forceps, and after serial leadingly, we mounted a appropriate size nail over the color-coded tibial nail extractor or RCT nail introducer compositioner, and finally we introduced the proximal as well as distal locking by freehand technique. So this is the flow diagram, nothing to repeat it again, and this is the post-operative follow-up steps. Again, you all are aware of this. This is same as the infrapatellar nailing of tibia. No patient complain of knee pain in our series. All patients you get full range of movement in our series by 16 weeks. At final follow-up, 4 cases found excellent results, whereas 13 had good results, whereas 2 had subacute infection at the screw site and 1 had infected non-union. The average time of union was 80 plus minus 10 minutes, whereas average fluoroscopy time was 38.5 plus minus 6.5 seconds. All patients followed 2, 3, 6, 8 and 12 weeks, and the average time of the union was 8 weeks post-surgery, whereas complete union occurred by 12 weeks in all our cases. These are the few cases, clinical and radiological pictures of the few cases done by Dr. Thakur innovative technique of suprapatellar nailing of tibia. So the number of studies done on this innovative technique is small. I think this is the only study done by me, although good number of patients were included. The study was not comparative with the standard technique, so a status of cartilage over the patella and the trachea was not evaluated in this study. Those furthermore study is required to compare this innovative technique. We had a high-tech presentation in IOACON and found a space in International Journal of Orthopedic Sciences. You can see, and this is the video. We don't have time to show you. So the take-home message is this technique would prove a boon for small and medium-class hospitals situated in BNC, Great Town in India and poor countries like Bhutan, Nepal and Bangladesh, where the allocation towards the health is very, very low. So this would prove also a very useful technique for Ayushman Bharat Yojana, which is the dream project of our Prime Minister Sri Narendra Modi. Thank you very much for patient hearing.